Hi Andrew, how you doing today? Dr. Morton.
Doing okay.
Good seeing you again.
Yeah.
So I got some good news for you. After looking at your x-rays and reviewing the tests we did yesterday, I feel confident to say that you do have a chiropractic problem. So that's good. And as you remember from the video yesterday that we had you watch, chiropractic's been around for a long time. It's not going anywhere. We've been treating people's problems like yours for over 100 years. So feel good that you're in the right place. So, but now that you know that you do have a chiropractic problem, I want to show you some stuff, and this is all in this handout I'm going to give you later to take home. That WebMD did a study on millions of people over several years that they are 95% satisfaction rate with chiropractic. So that's harder to find in any other health profession in the world. We're also the second largest healthcare profession in the world now, because that's how successful we've been. So now to answer your question of why you feel this way, why are you in this pain? See, it just wanted to let you know that this didn't just start when your pain started. This has been an accumulation of things. It wasn't one twist, one turn, one picking something up heavy wrong. This actually started from the skeletal trauma accumulating from childbirth. Even so, imagine if you didn't brush your teeth from the time you were born. Yeah, what your teeth would look like. Okay, yeah. So that's the same thing with your spine. And imagine if you, let's say, didn't mount and balance the tires on your car ever. Blowout's inevitable, you know, and you've been experiencing all this nerve and tissue damage, and who knows how much of that you've done. And this is with no treatment, no care, no anything to offset that wear and tear. So it's an accumulation of things. It wasn't just that. So now, if I can find the right page here, sorry. Now the result of all of this accumulations, all these things, is what we call subluxation. And see these here, these are the vertebra and these are the disc. And what happens is these discs get compressed and they come closer and closer together, which causes a loss of flexibility, irritation, swelling, and it also pinches the nerves, as you see here, that come out of those vertebrae. So I think you'd find it interesting here when you take this home and read these. These are some different symptoms that you can have when you, out of those levels of the spine, different subluxations and whatnot. So down here, we have the degeneration process, and there's 4 phases. And right now I'm going to put you in phase 2, because after viewing your x-rays, that's what we show, which I'll show you here in a minute. But this is just like cancer or anything like that. The longer you let these things go, the worse the problem is, the more severe the symptoms get. So that's why I'm going to show you your x-ray here and show you what's going on. All right, see here, your curve is a little hyper, is what we call a hyperlordotic curve, which means they also say every inch that your top vertebra is past this midline, which are about 2 inches, they say it doubles the amount. Your head weighs about 8 pounds. So, you know, 1 more inch past that, that's like carrying around a 16-pound head. So that's your main problem right now. And then you're getting some facet arthrosis back here, which is very common for having that anterior head carriage out there. But you can't take these home with you today, but I am going to circle on here the part which is stage 2, so right here, and you can take that home and show your spouse, okay? So I think I've spent enough time showing you how you got this problem, but let's move on to the part you want to know, and that's the solution. Now, like I said, you didn't get this way in one day, and we're not going to be able to fix it in one day either. Your spine has spent years getting pushed and pulled in all sorts of ways, and it's been out of line, and that's actually starting to think that that is normal. So how we're going to do it is we're going to treat you with a series of adjustments, and we're also going to supplement those adjustments with therapies. And how it works is you're going to come in every day this week, and then 3 times a week for 2 weeks, and that's the pain relief stage. That's what our very first stage is, to get you out of pain. So once we get you out of pain, and after those adjustments and that's set, you're probably going to be feeling pretty good. You're going to be wanting to go out, do everything else, but that's not the case, Andrea, because what happens is you're in a fragile state. So that fragile state is really dangerous, because you can go out, one twist, turn, wrong move, anything can send you right back here, and you could be the same or worse than you are even right now. So before we get you into stage 2, which is stabilization phase, we're going to do an update, a progress, and evaluation, see and make sure that you need as much care as we thought so in the first place, and if not, we'll be anxious to drop your care down. But we're also going to show you, or you're going to graduate into the stabilization phase, and that stabilization phase is easy for you. It's 2 times a week for 3 weeks, and through that stage you'll start feeling better, still be pain-free, and then at the end of that phase we will get you to the prevention phase, which once again we'll do another progress examination. And the prevention phase is usually just once a month, once every 3 weeks, but we'll make that decision when it gets down time. The reason that the prevention stage is so important is because you're not stopping doing all the things that are hard on your skeletal system. You're not stopping any of it. You're still causing subluxations. It's kind of like if you get your teeth cleaned, it'd be nice if they stayed clean, but you'd have to never eat again. So that's not going to happen. So that's what the prevention stage is for, also our maintenance program. So now that I've showed you all this, I'm ready to get started with you, but first off, you're going to have to do a couple things for me. First, you're going to have to make all your treatment times. Okay. It's chiropractic, how it works is the number of adjustments and the frequency of those adjustments is what gets your spine in line again. So that's number 1. And number 2, I have some tickets for you on this How to Stay Young class. I think you'll find it quite fascinating. It's called How to Stay Young for the First 100 Years. I got some tickets in here for you and your family, and it would benefit them as well. It's like something you've never heard or seen on health before. So I teach that on Mondays at 12:30 and Fridays at 12:30. So which one of those is better for you?
Friday would work.
Friday would work? Okay. I'll tell Teresa up front, and I'll write that down. And yeah, so we're ready to get started. Just that's that.
All right, great. Thank you, Doctor.
Yeah,
Appreciate
thanks.
it.